Riverside Healthcare puts the health and wellness information you need well within reach.
Hello, welcome to Well in Mind. My name is Sean O'Connor, and I am a marketing communications representative. And I'm joined today by Mary Brandenburg. Mary, how are you doing?
I am lovely on this gorgeous day.
Fantastic, fantastic. I always want to make sure I'm getting it straight. What is your full title? What is your full certification?
All right, so this is going to be a lot of alphabet soup. So it's BSN, MSN, FNPBC, ONPC. So that's like the shortened alphabet soup version.
Very good. Excellent. And so that allows you to, gain secret access to certain things? or what?
Yeah, you have to have the special wink with it. Along with everything. But the BSN is the Bachelor in Nursing, so that's my RN. Mm-hmm. The MSN is my master's, so that's where I went through the master's program to become a nurse practitioner. FNP kind of gives you a subset of, okay, so I'm a family nurse practitioner, so I see the whole range. I see everybody in the spectrum. And then the ONPC is I went through additional certification to become certified with orthopedics, and I'm one of 10 in Illinois.
Wow, that is fantastic. So you have a specific passion for orthopedics.
Yes. Yep.
What led you to that specific passion?
It's funny because my first exposure was in my LPN, because I started at the very beginning with a licensed LPN, then RN, then BSN. I went the whole gamut. And when they showed me the external fixators for the orthopedics, I was like, oh my gosh, that's so archaic. And then I got into trauma. I did a trauma rotation in Atlanta, and it was it's great to see the end product, so people are able to heal and see the positive outcomes for the patients.
Yeah, sure. Excellent. So you're over the walk-in clinic at the Orthopedic Spine Center.
Yes.
Yeah. So what do you treat there?
I see everything. So it's the whole title is a Riverside Orthopedic and Spine Walk-in Clinic. It's kind of the community's alternative to the ER.
Okay.
So minor fractures, bumps, bruises, sprains, strains, back and joint issues, so neck and low back. The service provides our neighbors with a quick alternative to going into the ER, so the turnaround time, we try to keep it pretty quick, so we're in and out of there usually within an hour-ish.
That's really good.
So we do a really good job with that. No need to wait those long hours in the ER and waiting to get pulled back and just being exposed to everybody when we have the current situation we have, especially when you go to the ER for an orthopedic concern and then they page orthopedics and then orthopedics comes instead of coming straight, kind of cutting out the middleman kind of thing.
Yeah, I think sometimes that's one of my greatest frustrations is that I'm going to go to the ER or go to the doctor knowing that I need to go to a specialist, but I need to get that referral to go to this. Now, people don't need a referral to come into the walk-in clinic.
Nope, it's considered like an immediate care process. It's very similar to the ER in that respect. Mm-hmm.
So you say minor breaks, we're talking just kind of fractures, or it's broken, but
You're pretty sure it's broken, but you're not seeing anything come through the skin.
Yeah, you don't want to see anything gory.
No, well, I don't mind it, but you would be better served to go to the emergency room, and then that way we can get you to the further treatment that you probably need, not to...
Yeah, that's a little more
complex.
Yeah. Well, being a compound fracture.
There we go.
Look at that. Little medical humor for everyone. So what do you have on site there at the Orthopedic Walk-in Clinic that kind of helps you?
Well, we do have a X-ray machine, and that's kind of key for what we do. Mm-hmm. We also have the ability to cast, to splint, remove casts if somebody has a cast and it's becoming uncomfortable and there's concern for some other issues. We can remove that cast. All the surgeons are a quick text away. They all respond rather rapidly. And it doesn't matter who's on call. If it's subspecialty, they all respond very quickly and very helpful in that regard. So if we need to move quickly and move a patient up to a further thing, then we can do that. Planning on having a CT within the next couple of years. We have the room for it. It's not quite there yet, but it is coming, and that makes it very exciting because that makes it one more additional aspect as well.
Sure. And then you've got the entire Orthopedic and Spine Center there in that building too. So you've got PT, you've got occupational and hand therapy. So everything's in there.
Everybody's in there. And I refer a lot to the PT over there because the PT, their gym is phenomenal.
Yeah.
They even have the hash marks for the field. So they're ready for everything.
and they said, well, we want to start highlighting PT more. And I said, well, yeah, but we've got one gym that really stands out, and we have a lot of great other facilities, but that gym's really kind of the crown jewel of our PT system. And so that's a beautiful gym. I don't recommend anybody gets themselves into it, but
yes.
It is definitely worth seeing. So
absolutely.
Yeah.
I actually had a self-proclaimed gym rat who was actually very excited to get referred to PT because she went in the wrong direction when she came in. And she initially went towards the physical therapy. Mm-hmm. And she's like, oh, can I go to that gym? I was like, absolutely. You can go wherever you want.
Yep. That's another great thing about PT is you can choose where you want to go. So.
Yep. We got them all over, and they're all great providers. So all the patients that I've had that I've referred out, they have a great response coming back. So.
And you don't cover just bone injuries. You mentioned head and neck. And so if you sleep wrong, kind of got like an ache and pain in the neck, you're more than welcome to assess it. And
absolutely for the neck. Head, if we're talking like headaches or anything like that, or any brain issues where you're concerned about a concussion, that becomes too complex too quickly. Okay. So that would go straight to the ER. Okay. However, that's a good distinction to make, though, because a lot of people get that kind of confused. But the neck, absolutely. You sleep wrong, or if you have this like crick in your neck, you just can't quite get out. Or come on in, we can.
The back, you know, and that's one of those things where as I get older, I bend over to pick something up, and then oh, that's not supposed to happen, and that's never happened before. Yeah. But now, all of a sudden, now we got, you know, getting old is surprising. I thought it was going to be a smooth transition, but...
Well, unfortunately, we got these crazy bodies that continually change, even from when we're an infant. We're always changing, always progressing. So learning the new normal is always kind of a twist.
So with fall sports starting, what are some common injuries you're going to expect to see?
Kind of expect to see a lot of sprains, strains, some minor fractures like wrist fractures, maybe some ankle fractures, shin splints, so some pain in those shins. But those are the bigger ones I'm kind of expecting. Yeah. And those are the ones I've seen before, so. Yeah.
And it's important to get those assessed sooner than later. So if you think you've sprained or strained something, you should probably get it looked at rather than wait it out and kind of see if it goes away.
Yeah, it's reasonable to wait just a couple of days and just do that RICE method. So the rest, ice, compression. So ice 20 minutes, 20 minutes on, 20 minutes off. Compression would be just like a simple ACE wrap, nothing too tight. And then elevation, getting above the level of your heart. That's reasonable to do that for like a day or two just to see if it starts to improve. But if it's not improving and if you've got that bruising, then it's better to get it looked at sooner than later, because then it potentially could prevent it from becoming a more complex, longer lasting injury. Okay.
And not just bones either.
Not just bones.
Tendons too.
Absolutely. Tendons, muscles, ligaments, all those things. Yeah. So if we get you immobilized or get you treated appropriately, then the duration of the symptoms can be shortened.
Yeah. So it was a couple years ago, but somebody I knew, probably not my wife, but I'll embarrass her, gave my nephew an underdog and actually strained her tendon pretty hard. And so so that was a prime example where we should have went to a walk-in clinic, but at the time it wasn't available. So now we have a walk-in clinic, and it's very important. Yeah. So what do you recommend for young athletes to stay fit the entire sports season?
Definitely stretch, get the blood moving, and then stretch it out. Make sure you monitor those fundamentals. The coaches aren't joking when they say that's the base of everything, because if you have the fundamentals down, then you're going to be moving appropriately when you're doing your activity. But the stretching and then making sure you appropriate recovery. So,
and that doesn't just apply for athletes either. That's more for just everybody. You know, it may seem odd, but even if you're doing yard work, it's not a bad idea to stretch things out, because you don't just see sport athletes or athletes, but you see the whole gambit of people outside. So
yes, we do. And I did too much over the weekend, and I didn't stretch right after. I got in the pool, thankfully, because that kind of helped a little bit. But not stretching after we did some yard work, and I certainly felt it. So, and to refer back to as we get older, just those muscles aren't bouncing back the way they did. So we just need to make sure we're getting that good stretch on afterwards.
Excellent. Anything else we should know heading into sports season? or about the walk-in clinic. We do have Saturday hours starting.
Yes. This is very exciting. We're having Saturday hours starting on the 28th, and it's going to be rotating through the providers, so you're going to be able to see any one of us who comes in, so that'll be great. I think a big thing to keep in mind, especially for the walk-in clinic, or just in general, is if you have any aches or pains and you see some of the kind of cardinal things or the big red flags or things that you want to make sure you get evaluated, significant swelling, numbness or tingling, pain when you're bearing any kind of weight, and that goes for the upper extremities, so the arms as well as the legs and the hips and the knees, because pain isn't normal. I know some people say, oh, just walk it off. It's just part of life.
It's part of getting older.
It is, but to a certain extent. I mean, that's not your normal baseline. You don't want to be living with pain daily. Pain shooting into multiple areas. So if you have that pain in the wrist and it kind of shoots up to the elbow or from the shoulder down or anything like that, pain that gets better but comes back. So I've seen a couple of that too, where it's like, oh, it gets better, it's better, and not so much. And then it's kind of, you got to play catch up. And then lasts longer than like a week. If it's over a week, then you really need to get it evaluated.
Yeah. Okay. That's very good to keep in mind. So, and we're talking 5 days, 7 days, or
5 or 7 days, either one.
Okay.
Those are both reasonable. If you've tried all the rice that we talked about before, then it's reasonable to get it looked at.
And one other thing to keep in mind with the walk-in clinic, like you said, it's like an immediate care visit, a lot less expensive than the ER visit. So
absolutely,
less time, less waiting, less expensive. So it's as we say, walk in, walk out happy. So
that's the plan.
Yeah. So, are you from the area originally, or?
No, originally from Cincinnati, Ohio.
Okay.
But my husband was military, so we bounced. By telling you my history, you would hear my resume. So, we've been literally all over the world, from Kentucky, Georgia, Texas, all the way up to Germany. So we've been everywhere. But I have a sister in Oak Park, brother in Peoria, rest of the family in Cincinnati, among two others in the outliers on the East Coast. So we're kind of nestled nice in the middle right here, which is really nice.
So this isn't your first Midwest winter. So that's...
No. No. Born and raised in Cincinnati. So and with my sister being up in Chicago for 30 years now. So I've seen quite a few winters.
I got to experience my first Cincinnati summer this year. And so, I mean, I thought it's hot here, but that's impressive hot. So
it's humidity on another level.
Yeah. It is. It's unrelenting.
Nobody does their hair there, because if you have any curl in it, you walk outside and it's whoosh. So it's just don't even bother. Just stick it up in a ponytail.
The good thing for me is I never have to worry about that.
Yes, I see that. That's a good thing, though. It's a new view. You just got to worry about the sunscreen.
Yeah, every day, any day. So
there you go.
Me and my son were the only ones at the Grand Canyon in March, 50 degrees, and we both got sunburned. So that's what happens when you're red-haired. Yep.
See?
Yeah.
It's that Scotch-Irish.
Yep. Well, thank you very much, Mary. I appreciate you joining us today. And like we said, if you have any bumps, bruises, sprains, strains, or minor broken bones, come see Mary at the walk-in clinic at the Orthopedic Spine Center at 45 and Burns Road.
Yeah. We'd love to see you.
815-802-7090. That sounds right. Yes, it is.
I think so.
All right. Thank you very much.
Thank you.